Tiene que ver.
But this is going to be a Framingham online calculator or Framingham score, which can be used to actually check out the 10-year mortality rate of an individual and then decide whether that person will require statins or not. I repeat the fact once again. One is Framingham criteria for determining the presence or absence of value that you need to obtain is less than 150. But if a person is a high-risk patient, example of high-risk patient can be like he is having a family history of coronary artery disease and he's a smoker as well. He has a sedentary lifestyle, and let me say he also is obese. The more you increase the risk factors for coronary artery disease, more the risk of the person will definitely increase. And for those patients, the cutoff for LDL has been now less than 100 milligram percent. But I can now introduce a person who I can call as very high risk. Now, obviously, lots of time you might say, sir, is it possible to remember all these aspects? So the minimum I expect you to remember is what I will say next. Suppose in the exam he gives you a scenario for diabetic patient, or he says that this diabetic has already developed chronic kidney disease, or he gives you a scenario that person is on hemodialysis. You very well know hemodialysis itself causes exalted atherosclerosis. So these are patients who are, I would classify as very high risk patients. In these patients, the value of low density lipoprotein should be kept as less than 70 milligram percent. In fact, there is no change if you compare this data with respect to last year notes per se, because I've said this statement earlier also. At the moment, I've just introduced terms like low, high risk or very high risk. The standard information which is same as last year is for diabetic patients, for CKD patients, hemodialysis patients, because the risk of coronary events is more. The target of LDL is different from ordinary population, and out of these values, at least one that I want you to remember is what I have just said. Keep the values as less than 70 milligram percent. That's the main objective in any diabetic or any person with diabetes with chronic kidney disease, because you will notice that the number one cause of chronic kidney disease again happens to be diabetes mellitus, and the combination of the two increases the cardiovascular mortality. The message here are two. One, you need to remember Framingham criteria, which are discussed in congestive heart failure. Framingham score per se is an online calculator by which you can know the 10-year mortality rate based on the values of the bed host to age and couple of other paraphernalia or information like smoking, etc. The message is that for diabetic population, try to keep these values less than 70 with the usage of high intensity statins. You don't feel like going to your office, not doing anything, we will do a blood test in you, that is CPK-MM. I mean, it should not come as a rude shock to the patient that you have not informed the side effects of statins, and he starts developing a statin associated myopathy, and it is a later diagnosis that you make. So it's always advisable whenever you give statins, one, always give them at bedtime because maximum cholesterol synthesis occurs at night, and second, always inform the patient about the side effect at the time of introduction itself, that if you have muscle pain, you need to come back to me. I mean, try to make it, I would say, medically safe for you, and at the same time, give a proper information to the patient so that he can make a proper decision about reducing his risk of developing heart disease per se. Next, based on the explanation of atherosclerosis per se, I am now going to show you two coronary arteries of two different patients. The yellow in this case is representing the atherosclerotic plaque, where there's going to be presence of foam cells. Well, foam cells are modified macrophages, and they're called as foam cells because the cytoplasm is not clear, primarily because there is presence of the oxidation. It's not that the wall on the right cannot have a tear. Yes, it definitely can have a tear, but rather the main problem in this person will be a significant luminal obstruction or luminal reduction. So the amount of blood supply that will go in distal circulation in this person will be